Hi everyone, good evening, it's just Damian. I just wanted to make this video to get a lot off my chest, and I'm sick of making videos like this in this kind of format about mental health services and that kind of thing, but I have to do it. There's going to be some positive stuff in the end about my Kylie trip and some other stuff, so stay tuned. It is going to get a bit grim, but then it's going to get a little bit more citable, should I say. Yeah, just to start off with, there is talk still about me being open to a community mental health team again, and I am getting flashbacks to what's happened in the past with various teams near where I live locally, and various people from that team, and I keep getting flashbacks and really bad trauma with it. So I am it's triggering off some bad memories and painful memories. I managed to get the mental health under control with my doctors, who are amazing by the way, and I love their style and love their way around it. But since there's been a re-referral back to community mental health, it's made my anxiety worse, and it's a lot contradictory because the doctors aren't aware of me being open to a mental health service. I was open to a doctor's surgery last year, and when I told them that I was discharged from mental health services, they thought I was open to them. But this time, I'm open to mental health services, and the doctors don't know anything about it. So, different story, different story. But I'm just letting you know. So, basically, they're wanting to open me up to mental health services again. I'm getting really bad anxiety and trauma from what had happened. And I'm trying to let people know, look, this is why I don't want to work with you. This is why I don't want to work with you. This is that. So there's there's been times where I'm scared of safety plans not getting followed properly. Like in the past, September last year, for example, I got I got into a situation. I got bad thoughts with it, and I rang the crisis team. The safety plan states to do that. Crisis team are like, we don't deal with these type of thoughts. You need to in the police. Police pass me on to the crisis team and back and forth. So I got arrested for misuse of the police number, and then I got arrested for malicious communication as well because I'd rang someone else for extra support and that kind of thing. During my arrest, the mental health services had told the police that I've not been taught to contact anyone when my mental health's bad and that the plans don't exist. But then one of the people that was at a meeting after I got arrested stated that the bail conditions were in contradictory to what my plans are. So it's just scaring me a bit with a lot of the safety plans and that kind of thing, to state that to state that to state that to state that I need to follow this, and but then they're like, the guidelines recommendations only, we don't have to follow it. So they're like, guidelines recommendations only, we don't have to follow it. But then it's hard as well because I've been reopened up to a mental health service in that again, which I don't want to be open to. My doctors know that I'm doing well at the moment. However, I just find it a bit contradictory and a bit hypocritical in that with what path I need to go. Confusing, sorry, not hypocritical. I just find it really contradictory and confusing with the path that I want to go down, because on one hand you're getting the doctors stating that you're doing really well at the moment with us. We wanting to win the appointments down. We wanting to increase the time between appointments because you're doing really well and we're covering the same stuff each time we're seeing you. Basically, it's like positive improvement, positive improvement. But then you're looking for support on the other hand that are like, you need primarily mental health, you need to be doing this, doing that. So it's just a bit confusing and contradictory. There is stuff that I am trying to trace up in that as well, with going to court and the bail conditions, for example, my mum had stated the other week, no, the other yesterday, stated that she stated that she stated that she feels that at the moment, because my worries and that are getting passed back onto the police, and that my worries are getting passed back onto the police, and the police are referring it to ambulances come back, that she feels that it's going to look bad for me on my court case and that kind of thing. So I'd rang 101 yesterday and just stated what Mum had said. Look, I'm getting the police sent out. No, what it is, no, I'll start again, sorry. I'd rang 101 yesterday to state that I state that my mum is a little bit confused because she's confused that because I'm getting welfare calls from because I'm getting reported to the police because of the anxiety that I have with mental health services, the police send an ambulance is not out, but it could look bad for my court case. And the woman was like not understanding properly, and she was like, for your anxiety, we suggest you in the ambulance service and that. But I'd rang the ambulance services and just asked what the what the police had said. However, this is where my biggest mistake came in. This, they're like, this is this is not a mental health matter. This is not something we cover. Sorry, I didn't mean to say mental health matter. This is not something that we cover. Is there anything else? Have you got any other symptoms? So basically, I said that I've got I've got anxiety symptoms and what they were, and they're like, we need to put you down for a call back. And I'm like, I don't need a call back. It's manageable. The doctors are aware of it. And it's manageable. The doctors are aware of it. I've got an appointment with the doctors next week, which I have. I'm seeing my doctor on the 4th of June. So I said I've got an appointment next week, which I genuinely have. And I'm like, it's my normal anxiety. It's a little bit in heightened because of wanting to be back with the mental health services and again, but it's like manageable. It's normal for me, and that 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 it's manageable. And I'm like, I don't need a call back. I've got no intent. I've got no intention of speaking to anyone. So I thought she'd cancelled the call back after we'd had a bit of a chat and that kind of thing. But then it's like, but then it's like I'd started getting about three or four more calls from 111, ringing back. Look, there's nothing up with me. There's nothing up with me. I'm seeing the doctor next week. I've got no intention of speaking to your staff. I am a little bit concerned that because I'm not answering the phone, that it's going to lead to an ambulance getting sent out, which is something that I don't want. So kept bringing back. You don't have to answer the phone if you don't want to. The advisors will then make a decision after that. So they're like, we've got a duty of care, and I'm like, how is it a duty of care when it's just making my anxiety worse? So the ambulance came, and the ambulance came, and I got upset, walked out, and they like started following me, and it made my anxiety worse. They like started following me, and I'm like, they were a bit annoyed, and I'm like, "You've called for an ambulance. Are you coming in? Are you going to be assessed?" And I'm like, "I haven't called an ambulance." So I'm like walking off, and they're like, "We're not going to follow you. We're not going to follow you." But then they were like, still following me, and that made me scared a bit. So I was walking about, and then I'd went back through the pathway at the end of my street, and they were like stood in my front for a bit, and I'm like, "I've got no intention of speaking to you," and that kind of thing. But I've got no intention of speaking to you, and it's like I had to go into the pub over the road to go into the pub over the road near where I live. Sorry, I'm banned from there anyway, so I had to go into there, and they had to lend me his phone so that I could ring back and explain, "Look, I don't want to see the ambulance. I've got no intention of speaking to the ambulance." But then I got home, and they said on the phone they were doing paperwork and that. So I got home, and there was no paperwork there. But it's just a little bit frustrating in that, because I am not wanting to work with secondary care again, and it's a lot of like services and that are passing me on from one person to another, and it's hard because it not many people know what to do. It's like you need to ring ambulance, you need to ring the mental health service. I'm like, I don't want to be open to the mental health services. It's making my anxiety worse. I'm getting flashbacks and traumatization, and then people are like, having flashbacks and traumatization means you need to be working with them. And I'm like, I don't need to be working with them. This is making it worse. Would you say to an alcoholic, "Oh, I think the best thing for you is to drink"? Would you say to a heroin addict, the best thing for you is to take heroin? Would you say to a cocaine addict, the best thing for them is to take cocaine? No. So, would you say to a prostitute, the best thing for you is to have unprotected sex? No. So, it's just hard at the moment because this is what's triggering it off, and it's just really making it worse because I don't want to be down the path that I have been down anymore. I know what I want. I know what I want. My mum isn't happy with my advocacy team because I did ask. I did ask for. I did ask for re-referral back to the advocacy team, but I felt like no, I did ask for my advocate to re-refer me back into mental health services, but this was because I felt pressured into working with the mental health services. This was before I'd started working with my communication therapist and the doctor properly, but this was like I felt like I had no alternative. Things were backfiring in my face, and I'd been honest with my advocate about that kind of thing on more than one occasion. And my mum's like, "Your advocate, you told your advocate that you didn't want to work with the mental health services, and you, she should have told them after I stated that I felt like I was pressured into the meeting and into the decision." She said that after I told my advocate on more than one occasion that I feel like I was pressured into the decision, that my advocate should have been making the mental health service aware of that. And she's not happy about that. She's also not happy that an MDT took place to try to get me re-referred back into mental health services. And we were under the impression that it was going to be to look at other options, other alternatives. I'd put my name, I'd put down, I'd reapply for some extra support through other teams, other places, but then But then the problem was that they said they're going to have a MDT meeting. I was told that the meeting would be to look at alternative options, and they needed to keep everyone informed about what's going on and why it's going on. And they needed more people involved in that. And they said that to me after they'd put secondary care in there when I was confused that I didn't, because when I was confused that they were putting secondary care in there when I don't want to be working with them. So my mum's not really happy about that meeting. And yeah, it's just stirring up bad memories. I don't want to be in the situation that I was in 2 years ago where I was overdosing and self-harming to cope with this. I am in a much better place now. I want to get to the 20th of June where I haven't overdosed in 2 years or self-harmed in 2 years, and I'm really proud of that. And I don't want this anxiety pushing me back into a bad path that I was in. I generally know that I have been much better with uh, working with my GP, working with my communication therapist. However, all the anxiety in that started again when the re-referral was open to secondary care. I am just going around in a vicious circle at the moment where I am getting the flashbacks up here and it's scaring me. However, the problem is it's getting referred back to the police, back to secondary care, no, back to the police, back to the ambulance, and notes getting put on my record to state that I'm making threats when I am not. I have been getting thoughts and that and flashbacks that I don't want. I've let the police know that. I've let the police know that. I've let the 111 know that. And I didn't really want them to refer me into the crisis team because I have been told under bail conditions by the police that I am not allowed to ring the crisis team or whatever because of the bail conditions. I am trying to follow that advice, and I have been going round in a vicious circle again where I'm ringing the police, they're letting the ambulance service know, the ambulance they're letting the ambulance service know, or they're letting me, or they're telling me to ring the ambulance service, and I'm like, I'm ringing the ambulance service. We'll need to refer this to the police, and we need to refer this to the police, even though the police have told me to contact them. Then they're referring it to the crisis team. Then the crisis team putting it on my record that I'm making threats when I'm not, and it's just this vicious circle. Left hand doesn't know what the right hand's doing, so it's this vicious circle really because I don't know what's going on or who to turn to, and it's like you need to be working with mental health services. I don't. I know that this is triggering off the flashbacks and the bad memories again. I just feel let down by the system and that kind of thing. And a lot of the time, the police are telling me, you need to be bringing the crisis team. No, the police are telling me, sorry, you need to be bringing the ambulance service and stating that you've been in touch with the police. This isn't a police matter and they need to be dealing with it. But the problem is, if you work for the ambulance service or the crisis team or mental health services or a GP, would you believe someone that would you believe someone with mental health issues that they've been in touch that they've said they've been in touch with the police and the police have told me that it needs to be their responsibility? I've tried they're not going to believe it because they've got mental health issues. They're going to believe it coming out the horse's mouth. By what I mean is, the police need to be ringing that service and telling them rather than me telling them. There've been times before where I've been arrested and told by the police, look, you need to ring the mental health services, let them know, let them know what's going on and why you're up and the why you're upset, why you're getting these thoughts, and that it's a mental health matter, not a police matter. I tried doing that with the mental health services a few years ago. All I got told back from them was a threat's a threat, and then they didn't want to know anything after that. So yeah, it's just at the moment that I'm going round in a vicious circle, and my mum's not happy about the way that my advocates have dealt with this, and about the way that my advocates have dealt with this. My mum, as I say, has concerns as well. I'm scared that of past experiences, and I'm scared for myself that I'm gonna go into old patterns of overdosing and self harming again, which I don't want to do. It's been 2 years nearly, and I don't want to go down that path again. However, when I was open to community care before, a member of staff who I'm not naming stated to me on more than one occasion, I don't mind if you overdose. And he stated that to paramedics once. He even stated it when I took tablets into hand to him. And it's I don't want to go down that route again because with mental health services in the past, I've been told that I've let myself down, I've let the team down, but then they're like telling my mum, we've let him down, we want to do this, we want to do that. But then it's like I'm getting told the plans haven't worked because I didn't make them work or I've let myself down and that kind of thing. Even plans where my advocates have said it's not worked as well. I tried explaining that to mental health services as well. My av- my advocates don't think some of the plans are working as well, and they're like they didn't work because I didn't let them, I didn't make it work or whatever. But it's like I don't want to be going down this route anymore, and I don't want to start overdosing again. I don't want to start self harming again. I don't want to put staff in severe fear of their lives again. And I don't want to be arrested again. I know that last year I was getting anxiety towards this member of staff, and the I sent an email looking for private help, private support. Police have been out. We know who you get your anxiety towards. We know why. And we're not taking it any further. Following Tuesday, following week, sorry, this was the Monday. The Monday the next week, I dropped a letter off at my advocate just so that my advocate was aware and she was aware of the situation and that the police and that I was so that she was aware of the situation, but she wasn't aware that the police had been out. And the police had been out again. This was on the Tuesday this time. Checked the laptop, checked my laptop, radioed the sergeant. I did ask them at the time would they like a copy of the email, and they didn't. They just read it on here. And then I did radio the sergeant. We know who you get your anxiety towards. We know why, and we know who you get your anxiety towards. We know why, and we're not going to take it any further. Following Monday, knock at the door. The police. I thought they were coming to do a welfare call. They came, seized 3 phones off me, my laptop, my tablet, and some other bits. Even hard drive that's connected to my games console because because it or because everything that I'd been asking for help with had been passed on to the matron and to this matron guy, and he'd stated to the police that he was in severe fear of his life, so they had to arrest me then. I don't want to be going down this path anymore, frightened that I'm going to get arrested because I'm worried that I'm going to say or do the wrong thing. It's like the problem is that I've had it before where the safety plans get changed, or we're going to change the safety plan to say this, we're going to get change the safety plan to state that. Uh, don't worry, we don't worry, you're not going to get arrested anymore. We know it's your anxiety, we know it's this, we know it's that. Try following the safety plan in a different way. The guidelines are recommendations only, we don't have to follow them, but then it's like, I get arrested, and that's scaring me because I feel like mental health, and my mum feels it as well, that mental health services are trying to push me into actively breaking the law. I have been told before by the police and by solicitors that I'm actively breaking the law, talking about mental health because it upsets others. And that's why I'd started overdosing and self harming a few years ago, because I was getting told that talking about my mental health was actively breaking the law by the police and solicitors because it upsets people. But then a member of staff was telling me, I don't mind if you overdose. So I felt that I had their blessing really to overdose, and they were for it and they understood from my perspective. And I felt like overdosing's not upsetting people. A member of staff said it was okay. And then it's like I felt that that's what I had to do. But yeah, I don't want to go down that path again or down that spiral again. I do know on the other hand that I would like some support and a bit more structure and a bit more routine to my day. I was offered some support with a few autism charities, and I felt like there was going to be real good connections there. And one of the ladies wanted to deal with me before she went on maternity leave because she knew that I'd been misinterpreted in the past. I'd let someone know from mental health services, and they were like, I understand completely why you're doing it. However, I feel like I understand why you're doing it, but I feel like you could do with some more specialist support. So I'd let them know, and discharge, then they'd discharge me because the was stating that my needs primarily mental health. So you kind of just find it at the moment where I'm trying to dig myself out of a hole, but dig deeper, deeper, deeper. But yeah, it's just hard at the moment because I'm trying to give. I'm trying to give 100% to everyone, but I'm like, how can I please this person? How can I please that person? How can I please this person? How can I please that person and please myself? Like, generally, my mum doesn't want me working with community mental health anymore. My mum doesn't want me working with community mental health anymore. My doctors have some doubts as well. I've got doubts. However, my advocates seem to think that the best thing since sliced bread, and that it's going to work. But I just find it a little bit hypocritical from the advocates because when things were going wrong with the mental health services a few years ago, my advocates were like, you need when I was given 100%, when I was really focused on getting it sorted, my advocates were like, you need to focus on something else to occupy your mind other than the mental health team. But now my advocates seem to think that they're the best thing since sliced bread. I need to be working with them. So I just find that a little bit hypocritical and a little bit upsetting because a few years ago when it was going wrong, they were advising me to look at other options, other alternatives. but now they seem to think that it's the best thing since sliced bread. But I know that I do need support as well. I would like a little bit more support with the gender, the sexuality, the Danielle side, and the autism, understanding the autism, a little bit more structure and stability and routine in my day. When I can get the structure and routine in my day, I'll be a little bit more settled, be a bit more open and a bit more supportive in what I can do. But yeah, it's like I want to meet new people. I want to get this back on track. I want to get that back on track. I'm genuinely scared that I'm gonna go back to how I was a couple of years ago, but I really don't want to do that. I want a bit more support from my family as well to understand that I might be this, to understand my gender stuff and to understand the autism, but I don't want to let myself down and I don't want to let other people down. And I know that working with mental health service again, I won't be doing it for me. I'll be doing it more for my advocates and for the people that want me to do it. I don't want to be in a situation where being forced into doing something because it's going to make me more scared and more anxious, and then it's going to be make it more scary and more anxious for me when it does go wrong, because I'm going to be like, I did this for you, this is what happened, and I did this for you, this is what happened, it's let me down, I told you it let me down, I told you it would go wrong, I told you I didn't want to work with him, but I don't want to be in that situation I don't want to be in that situation or want to risk that situation. I have looked at other autism charities and that as well, as I've given experience of one before. There's another autism charity that said my needs are too high risk or too specialist for them because of self harming and overdosing risks. And I'm like, I haven't self harmed or overdosed in nearly 2 years, and that I haven't overdosed or self harmed in nearly 2 years. But then they're like, you're too much of a high risk. But yeah, I've got ideas. I've got someone coming tomorrow to sort my electrics out. Had a welfare call from my energy provider last week, a couple of weeks ago, and there's a couple of things that aren't right. They're wanting to put a circuit breaker in between the meter and the consumer unit, and they're wanting to uh, put cover over the meter as well. So yeah, there's all that, and yeah, I'm petrified, and I generally don't want to work with anyone, and I really don't want to work with this person, work with that person, but I just feel like at the moment that I get one sent back, I need to be working with the mental health team. This is not going to happen if I work with the mental health team, but that's not me saying that. That's other people in my head saying that from the people that want me to work with them. So yeah, it's just trying to give everyone what they want really. But yeah, I've got other ideas in line as well. I've emailed a few uh emailed a few organisations for voluntary work and for training, and I've got a phone call with the job centre. I was going to say doctor there, no, but with the job centre on Wednesday. But I'm glad that that's happened because I've been trying to get an appointment with a disability advisor for about 2.5, 3 years now, and I've never been able to get one. It's like never been able to get one, and they're not really interested. But yeah, it's like I've never been able to get one. They've not been interested. You need to check with your care team or whatever. But yeah, I'm trying to put some ideas out there to help push me forward. So yeah, it's just about focusing on the positive rather than the negative. And yeah, it's just about being upbeat and that kind of thing. On a more positive note, I went to see Kylie the other night, last Tuesday, with my mum dressed. I was dressed, I had my sparkly dress on, I had the girls out, and I'd had the makeup on, I had lipstick on, mascara, and a necklace. Couldn't really see the necklace because my dress covered it, but I felt a bit targeted there, or didn't feel that the staff there knew about gender and could have been a bit more sensitive. So I had the dress on, had the girls out, and I'm like, he was looking at my chest area, and he was like asking what was here, and I'm like, I'm dressed up. It'd be obvious that I had a bra on, but it's like, what's there? And I'm like, it's a bra, but I'm like, you wouldn't ask a woman if you saw a woman with cleavage sticking out. You wouldn't ask a woman what was there, would you? So I just found that that was a little bit upsetting and a little bit distressing. But other than that, I'm fine. Um, but yeah, I'd just like to apologise in advance if this video upset anyone. But I'm not trying to do that. But yeah, thank you. Bye.